What if fear of the truth didn't hold us back?
Instead of having to do the research yourself, we've done it for you. Tune in each week as real moms drop some truth bombs.
Answers start now.
All right, welcome back to Truth Moms. Today, I'm just going to read this intro before we bring her on. Hopewell Family is who we both see as a wellness practitioner for our kids, and then us now, because I didn't realize at the time when we put River in that it was whole family. And then when I was having troubles with fertility, Jamie was like, we do the whole family if you want to hop on board, right? Jamie is a board certified family nurse practitioner, attended Black Hawk Community College, and received an associate's degree in nursing. After 7 years of hospital experience in the critical care unit, medical surgery unit, and emergency room, she sought further education, finished her bachelor's degree from Cumberland Online University, and received her Master of Science from the Tennessee State University.
That's me.
There it is. There it is. We know and love her as Jaimeé Arroyo from Hopewell here in Nashville. And it's funny, we started this podcast to really dive deep with some people who are kind of breaking industry standards with medical and, just care in general when it comes to food, health, wellness. And we have pretty much the warrior here with us, literally right around the corner. Yeah. My favorite thing about Jamie is her Instagram and her fearlessness on Instagram, because I do not have that type of fearlessness on Instagram.
Yeah. I love also how you make content so relatable and easy to digest and understand.
Yeah.
If you go to a doctor, they're going to sit there and talk all this jargon that I'm like, okay, whatever. But you sit there and you make it fun. And it's very different.
But it's edgy. And I think that that's what brought me, as we were introducing Jamie. So welcome, Jamie, to the podcast.
Thanks.
Very first guest.
Yes, very first guest.
And what intrigued me before it's like to be here with you is because how I found you was so unique, right? And maybe it's not unique. But I had a weird experience post-birth with an OB during pregnancy, really, and then post-birth was kind of like the kicker for me. And then when I had River, it was after everything I had gone through in traditional conventional medicine. I was bound and determined that there had to be a different way in pediatric care. And I had few friends of mine who are kind of entering into the scrunchy, crunchy phase, if you will, that didn't know where to look. And so I was kind of that pioneer in my friend group of where do we go? Who do we look for? And there was only a few different places in town. And luckily Hopewell, I was like, well, it's 11 minutes away from me, and you guys were, there was an opening for Riv. And so we had newborn care with River. But the biggest thing I had that I took with me for care for River that I didn't feel like I got in the OB situation was being able to have a conversation about care. And that's what integrative care, I feel like, is. We'll have you explain it in a second. But, with OB, with, my traditional pre-pregnancy, prenatal exams, it was very cut and dry. It was very cold. And then it got even more combative towards the end when questions arose around jibby jabs and checkups and things like erythromycin, which of all things I don't think should be controversial. We should be able to ask a question and get an answer. And I remember very vividly at that moment saying, because one of the things that had popped up, when you're on Instagram and you get like these what's it called? Your targeted. One of the ads I was getting targeted with was like top 5 red flags of an OB. And the very first one was if they use their years of experience at you as an excuse as to why you should listen to them, right? Basically throwing the book at you. And it was one of the things that she had done in my care was I've been in this industry for so many years. I've never seen this, right? So my biggest experience was I'd asked about something like erythromycin. And she said in my, I don't want to put her out, but she's like, in my such and such years of experience, not one child had a reaction, and mine did. So 6 weeks later, I go to my post-op and I'm like, hey, just so you know, you can never fucking tell me that you've never had a child in your care. have a reaction because one did. And that's all that matters. And whether or not I would have gotten erythromycin or not, if I had known, if I had felt comfortable to make the decision, I may have still decided to do it. It was more the feeling of force. And so when I moved into postnatal care and more importantly, pediatric care with River, I was not going to let someone boss me through her care. And, one of the biggest arguments I remember having with my OB was saying, you have all of this medical knowledge and I respect that. And I will never as a layperson say, I know more than you because of Google.
Sure.
But I am River's mother. And so as her mother, I deserve to know what I can expect and I make the choices accordingly. And we work together in her care. And so, when we found, there's literally only 3 places in Nashville, I believe, that are integrative or semi-integrative functional medicine places. And when we found Jaimeé, it was kind of it really was a blessing in disguise because it was the first time not only did I feel I was seen, but I felt like, as a first time mother, I wasn't going to walk through that feeling talked at. And that was important to me,
Yeah. And for me, I actually was at one of the other places that was integrative. I had denied pretty much everything during birth, like the eye creams, the vitamin K shot, all that stuff, all the vaccines. And I felt like the integrative care that I was getting at that place after talking to you that one day, because I was like, I think Easton might have an ear infection. What do you suggest? And she starts sending me all this stuff. I'm like, where did you find all this? And she's like, Hopewell. And I was like, I need to switch because they aren't giving me this kind of treatment. They're just giving me, give him some Tylenol. I'll give him wait, this isn't what I'm asking for. I'm asking for more holistic solutions to these problems first. That's what integrative to me was. And that's why I made the switch.
Yeah.
Yeah.
So I guess that's a great, crazy question. Cause you're like, okay, they're not forcing, a schedule on me, but they're also not giving me information on alternative care. So maybe it's something that we just don't understand. Cause even as we were getting ready to interview you, we're like, okay, do we call it integrative? Do we call it functional? What is it, the same thing?
Yeah.
Is it different? What is conventional versus integrative versus functional? What are those levels of care?
Yeah. So I definitely think Hopewell is a unicorn. And I love it and I hate it all at the same time because it's stressful. But I think we have somewhat successfully made a little bit of a fusion of both. Western medicine or allopathic care definitely has a place. And we incorporate it. So if a kiddo is in pain, we're not going to demonize giving ibuprofen or Tylenol when a child is in pain. We're not going to go there. Obviously we could use magnesium or arnica or other things, but I'm just saying there is a time and a place for medication. But the difference is we can lay out okay, this would be a symptomatic treatment, or this would be root cause medicine. And this is, we need to dig and see why your child has come to this particular place in their life. What are the puzzle pieces associated with that? And then we'll fusion the two. So if a kiddo is having a lot of ear infections, we'll go ahead and we will do in the moment care. We'll do garlic oil, we'll do halotherapy, which is a salt room therapy. We will recommend garlic oil. We will recheck that child to make sure that ear infection isn't getting worse. And all of those things are science-based. I mean, we didn't just one day go, we're just going to do these things instead of giving amoxicillin to every kid. In most journals of medicine, or even by the Academy for American Pediatric journal, even in that, you'll see a typical watch and wait for 3 days approach is totally normal and encouraged. And if you look deeper into the literature, an ear infection is 80 to 90% of the time is viral. And so, at that point, antibiotics aren't encouraged. So it's okay, if we can't just throw an antibiotic at it, and we, the child is in pain, the parent wants to make their child better. What are the other things that we can do?
Right.
But then that Western allopathic approach comes back when we like that child's come back in. We have done all the A, B, C, and D, and we're like, oh my gosh, this is actually progressing. This might be one of the times where we do want to actually use an antibiotic. Right. But you give all of that information to the parent because, again, like Riv's yours, Easton's yours. You have to like live with that decision of whatever you choose, and then empower the parent for that particular scenario to go, okay, I'd like to do A, D, and F. That's what I'd like to do. And, you can never, I don't care if you've gone to Harvard, you cannot put yourself into like the space of a mom. Like that child was like your DNA.
Yes.
You can't get any closer than that. And so one of the best advice in all of my training I ever heard did not come from a book, but from a fellow doctor who looked me in the face one day. And I don't remember much else of what he taught me, but he did teach me this. And he goes, always listen to the mother. Always.
I love that.
And he was like, it comes out in like what they tell you as far as like a history of the illness, and then also their comfortability. And let me just say there's only been 2 times in my practice in the last 10 years where I had to like override the mother. And it was because the mother actually was broken herself, and
I was just about to say that because there's times, Riv just came off of something where it was staff and Stephanie at the practice was like, look, we there's nothing we can do. We have to combat this with antibiotics at this point. And I remember going, okay. And I remember asking her, like, how can this form? And there was this feeling of guilt because for 2 weeks, I swore it off as a yeast infection. Or I was like, this is a diaper rash. Like, we're fine. I think I was like, even like, hey, do you have any diaper rash cream that you guys like, went and got the diaper balm. And I was like, this isn't working. And so when she was asking me like, how long has this gone on? And like, what did it look like? There was this immediate trauma of like, oh no, I'm being interrogated because I did something wrong. And thankfully she took me out of that. But I get that because you don't want to make you get so in your feels, you don't want to make the wrong decision, that sometimes you are making the wrong decision because you're so like, I had such a tough time in allopathic medicine, in conventional medicine, that I feel like everything can be cured with a tincture and I don't care, and someone does have to walk me out of it and say, it's okay. If your kid needs surgery, we're fine. If your kid needs an antibiotic, we don't like it either, but we're going to do, right? We're going to do what it takes to make them better. And then that comes back to, at the end of the day, we just want a healthy baby. We need to get our babes to feel better. And none of us are feeling good about the sickness, and how can we make it, together, how can we make this baby feel good?
And I will say, I mean, I guess it does stand out though that like, you get all of those options. And I think some moms come in like, please just tell me what to do. And you have to like ride that line of like, okay, who wants to be educated today? Yeah. And who is in flight or fight today? And like, oh my gosh, the amount of like nervous system support I have to give myself so I can come as my best version. I remind my staff frequently, like the well don't need a doctor. Right. Like the sick need a doctor. They're coming and they're going to be stressed. It's a financial thing as well. Like there's so many elements of stress that the families come when they're bringing their child in. It is not our job to make that worse. Right. And so like if you can like already disarm the, hey, I'm going to have to fight with you, like you can just reassure a parent that they're the ones that are in control. All of a sudden the conversation becomes fluid. Yeah. And and they can think.
Yeah. Or like in Stephanie's case, like, Brittainy, you have time, like it's okay that it took a week to figure out root cause. She's not, I mean, obviously there's other cases where it is more dire and urgent, but in this case, like I made my own breast milk paste. Like I was going nuts. And she's like, you were doing everything you could with the knowledge that you had. And then you finally were like, I'm not winning the war. I'm coming in. Yeah. Right. So like, you can't give yourself, like you have more time than you think in most of these situations to autocorrect or make a situation better. But I think when kids are sick, your immediate reaction is they have to get better in 24 hours or I'm a bad mom. Yeah.
I try to encourage, a lot of parents, like we're in a fast food society, and not just like, I'm not even talking about junk food right now. I'm just like, have it your way right away, any time of day. You know, like it's just that whole mentality of quick. And, you know, I don't get upset if a sick kiddo comes in. In fact, I try to reframe the situation a little bit in that I'm like, okay, no, like your kid's immune system is working.
Right.
It's flexing a muscle that is necessary. This adds another virus to their repertoire. They are more resilient after this. It is okay to slow down and be sick for a few days. There are so many benefits, even anti-cancer benefits from actually having an illness. I mean, there's even some that we protect too much against that actually provide a modicum of protection to like other future things into adulthood. So like, I try to like, not celebrate's a weird word. We're not like going out and like,
I got sick.
we got a sore throat. Like, yeah, like we're not trying to do that, but like reframe the situation and go, no, there is a time and place for this. And it's really good. During the pandemic, there was like a whole season where kids were not getting fevers and they were not getting sick. And that actually worried me a little bit. Because I was like, oh my gosh, their immune systems aren't working. They're not becoming resilient. You know, I feel like in the years following, it was like catch up big time.
Yeah, because we saw that, right? And almost even down to even more autoimmune or chronic illness has come out because all those years of being isolated from each other and not quote unquote sharing the germs has an effect.
Yeah.
Which is interesting to see that.
But, you know, like the relief in a parent's eyes when we go, okay, A, this is not your fault. P, this is actually beneficial. C, you don't have to trash your kid's system right now for them to get better. Like there's so much relief and freedom in that. And I think even as a parent, you start to, you know, your kids exercising their immune muscle, you're starting to exercise your parent muscle and you start to like gain confidence.
Right.
And go, oh, like, yeah, we got this.
Yeah. I mean, in a way, I feel like integrative medicine is almost more complicated, right? Because, you know, you think you go into a traditional medicine. I think about this. I was a traditional medicine kid, right? I went to the pediatrician. They did my checkups. Hey, are you sick? Are you not? And maybe wrote a script, maybe didn't. And that was it. There was no, I mean, I remember Margie vividly and I loved her, but it was just that's it. That's a transaction, right?
Yeah.
In this case, it's very different because even the questions are like, you know, how are they doing and what are they eating? And, you know, are you noticing any differences in behavior? Like it is a constant conversation of, not only are they meeting, you know, these quote unquote milestones, right? Can she say hi, bye, ABCs, but, you know, how is she progressing day to day? Is she eating well? Is she feeling well? Is, you know, I think it was really interesting when I came in and, you know, it's noticing changes, not just for the fact of, okay, what's next? What's the next step in care? And then, you know, the supplement world is a whole fun thing. Cause I think that's for some reason it's turning controversial, which I don't understand.
I don't understand it either.
Because why wouldn't you want to prevent illness by giving your body a boost instead of I come from a family who I have a family member that takes 9 different prescription pills and says, and it is just, that's what it is, right? You take this pill for this, that has a side effect that needs this pill for this. But if I said, hey, I have to take my vitamins before bed, I'm the crazy one because I'm taking D3, B12, magnesium, right? For them, they're like, what is this? And, you know, my grandmother, it's so funny. She's gone through a lot. She's had a lot of health issues and she's not been able to sleep. And I said, have you, you know, they gave her a lot of melatonin, even prescription melatonin. So now she's taking like double to triple doses. I said, have you talked about magnesium? And they're like, we can't add one more drug to her. Right. But they're just so in their feels that this is a drug, right? That the supplements are, you know, taboo, boohoo, woo woo a little bit. Yeah. And prescriptions are not. Yeah. Because this is the answer to the problem. And this is a building block to making sure that problem doesn't happen. So I feel like in integrative, it's almost more complicated to explain to them. Like we're working this way.
I think sometimes you might get a little bit surprised about what like Western modern docs would recommend or not recommend. I mean, there's multiple medications like the side effect is like lower potassium or lower magnesium or this or that. And so I think they do to a degree will say something, but I don't know. I think there is a mentality there. Some people are just going to be a little bit more consistent with the orange bottle with the white cap versus, and they recognize like the power of that and pay homage to that. But then, there's there's a difference. There's like a psychology to it, I think. And I've tried to like observe it and go, what is this? Like, do we just need to like white label all of our bottles so they look special?
Right.
But there is a psychology to medicine. In fact, for the first 2 years of my practice, I did not wear a white coat. I didn't want to. And people were like, we need the white coat, Jamie. You need to put it on. They're like, like almost kind of like going to church and like the priests and their garb, like it, you don't want a guy in jeans saying, I feel like your sins are forgiven. You want the person with the robes.
Right.
And so I like had to put on the white coat and, and I watched people feel psychologically better about that. And then when it comes to medications, like you get a script, you go to the church, the pharmacy, you get the sacraments. The orange bottle with the white cap, like it is, if you don't, until you kind of like start asking people like, why didn't you take your supplements? Or like, why, what, cause a lot of times I'm trying to figure out what works best for people. And so at first at HFC for the first, I think even 3 years, we did not sell supplements. I was like, nope, I am not going to do it. I'm not going to sell supplements. People will think I'm recommending them so I can make a buck. And I'm like, that's not why I'm recommending them. So they can go find them elsewhere. And then, patients would come back and go, I can't find that weird, what did you call it? And even though I had written down plans for people, they're like, I can't find these things. Could you consider stocking them? So like slowly we made a very curated repertoire or just of specific ones that we use. And even my supplement guy, Nick, every month brings me a list. He goes, which ones are we going to get rid of? Like which ones aren't working? And we make those decisions based upon patient feedback and lab values. And it's been like a very carefully curated list of ones that we keep. But I still do see patients who will stick with their medications but not their supplements. And I question myself in those moments. I'm like, did I not educate enough? Did I not teach enough? But I think there is just maybe our kids will be different, because they haven't seen mom and dad have lots of orange bottles with white caps around. Mm-hmm. I think it's almost like when you start to do something new, you're not necessarily going to see the effects of it for maybe like a generation.
Well, I even think our generation, like we have a couple of friends that are, Shiva being one of them, I can think of at the top of my head, who are also interviewing about, more individualistic types of care. I feel like our generation is the generation that's going, I don't want to look at all these pill bottles, right? Yeah. It's like we had hoarder parents, and we don't want to be hoarders, right? We're super clean. Right. It's like I've seen these bottles and I have to question, when does it stop?
There's just got to be a better way.
Right. Yeah. And so we now have these groups of friends that are like, oh, I've gotten medication free. I've been able to be off of this medication for this many years. And when you hear that, it's almost this like elating feeling that you're not, because I think, a couple of years ago, I would have said, you're going to turn 50 and I'm going to have to go take heart medicine. I got to go, you just think that's the route you go. You go to the doctors, you start taking blood pressure, you may or may not have a history of diabetes in your family, so you're probably going to take diabetes medicine. So you don't really think of, I can put my care first now and take these supplements and adjust my care individually, right? As I age, as life happens, pregnancy or, postpartum or, whatever happens in your life to your body physiologically, I can change that around and it doesn't all have to look the same, but I'm not chained to a pill bottle. Mm-hmm. That's freeing to me, but you're right. You have to turn around and say, like, as the person individually with all those pill bottles, you have to turn around and say, that doesn't make sense.
No.
You know?
Yeah.
I think it's actually been hard as a practice, have tried to figure out what our MO is, because we have this like question that comes up when we meet monthly as a cohort of nurse practitioners, and sometimes we'll bring up a patient scenario and we'll go, I need some feedback to know if like this patient is a good fit for us. And
wow.
Yeah. And it felt like everybody is welcome in the beginning. And as we like grow and we become such a nuanced practice, and a practice with like a huge waiting list, there are some patients who are literally just taking spots and don't want to do the work, don't want to learn anything, don't want all the options to be thrown at them when they come in. Quite honestly, I don't know how they heard of us or why they wanted to come. But I've tried to encourage most of my providers that like, hey, when you get a new patient coming in, if they already have like a really long list of medications, you need to have a very candid like first date talk with them, like a DTR. Let's determine this relationship.
Right.
And go, are we a good fit for you? Or are you a good fit for us?
Yeah. Wow.
And is that what you want?
Yeah.
Well, you know, like what?
Because there are different levels of care.
There
right?
are different levels of care.
So what? Then I guess that's a good question. Then instead of, you know, the different levels of medicine and what makes you guys different, who is the most effective? If someone's listening to the podcast and like, oh, that's me, I belong there. Mm-hmm. Who's the most effective patient in your practice for integrative care?
I think ones who, you know, like I said earlier, medication's not evil, but like they're wanting to work on their bodies in a way that I know it kind of feels like we're working ourselves out of a job, but like we don't want the patients have to be reliant upon us.
Yeah.
You know, like we want patients to have health freedom. And so like ones who will want to come in and be willing to like practice or experiment with diet changes, or like get their body moving, or consider whether their nervous system is okay, and like what their family line has brought to the table with that. Like what things do they need to look at, you know, to consider things like stealth infections, you know, in our environment, maybe to even like peek into their genetics. But like it's not all those like specific things they need to do. I feel like the ideal patient is one who's curious and like wants to find the root cause and wants to put in the work. Otherwise, they're literally taking the place of someone who's like begging to get in.
Right.
And it does get to that place where I'm like, okay, I've seen you for like a year, maybe 2, and we haven't shifted any of your medications. And quite frankly, like, I don't know if you trust me because you fight me on everything. And I'm not a people come in, I'm not like, you have to do it my way. Like we've recreated the wheel multiple times at this point, and you've just not latched onto any version. Is this what you want to do? Is this the type of healthcare you're looking for?
Right.
And I've had to very kindly say it sometimes, like you might want a different office. And very few patients do we actually fire. That sounds weird to say. It doesn't happen very often. Mm-hmm. But we just kind of encourage them, like, hey, you might actually want a different type of care.
Because that's one of the statistics that I'd found when I was looking at this stuff for our interview, is there is a shift to more integrative functional medicine relief. And you have to wonder how many people are like, just because they're like, oh, I want to feel something different than a cold office, right? Mm-hmm. Not necessarily ready to hear that you also have to work. It's like, that's the difference between Ozempic and going to the gym. Yeah. Mm-hmm. Right? You're not going to get immediate results. You're going to get, hey, we need to take a look at, and that's when I came in, right? So originally it was just for River. And then I was like, hey, you know, I was talking about wanting baby number 2 and having issues, and I wasn't getting my period, and, you know, but I was still breastfeeding. So we were throwing it out. And I remember you saying like, we're not going to do anything until babes after a year. Give yourself that for lactation amenorrhea. Then I came in, that was 6 months later. Because at 6 months I was like, I'm not getting my period back, right? Mm-hmm. So a year is in, I'm not getting my period back. And she's a year, and you're like, okay, great. Let's do some blood panels. Mm-hmm. And I was like, all right. And then they were like, okay, we did metagenetics testing. Let's talk about like what your body's more susceptible to losing right now. I was always vitamin A and D3 deficient. I'm always susceptible to it. And then you were like, okay, let's get on a few supplements. Let's see if this works. And then I remember you saying something about Arvigo massages, right? Which is totally outside of medicine or anything. It's essentially a movement. You need to go get this specific massage to get blood flowing into your uterus. And I remember thinking, and then there was a parasite cleanse, right? So that was all the course of an entire year. So a year and a half, really, because at 6 months is when we started the conversation. And it wasn't until River had turned 2 years and change did I get pregnant. And I think people, assume that you just do these, pony tricks of like, hey, all you need is taking magnesium at night and then your body's magically going to sleep better. Well, no, you have to let your body adjust. And that's where we're at, is let's test this and see.
That was the thing that really stuck out to me. Like when I joined your practice, for me, you were like blood panel right away. It's the first thing that you do. And you're really getting the root cause of everything, where some people are not asking those questions whatsoever. And I had the same kind of thing going on. You're like, hey, it'd be better for you not to get pregnant right now. Let's do all of this and then get pregnant. So yeah.
And in your fast food world, that makes sense because a normal, not normal, but a generic, patient who is used to that is thinking, well, I should have been prescribed IVF. Because you're like, why did I walk out of here? And I'm like, I'm going to take another year of supplements and hope for the best. What is this? But you're right. If you trust the process, you watch your body do amazing things.
It's a very much like a pick up your bed and walk type scenario. Like you roll up your own mat and you get up and you walk. Like we can't be hand holding every single day. Like we can't. That's impossible. And so like you have to. Yes, we can give the tools, but like the patient has to want it. And then like the uniqueness or the skill level of our providers, I feel like, is like where we're trying to figure out what's going to work best for a patient's like psyche, or where they are. Like you need to be able to like look at a person and see them. And that requires some time. Right. That requires like building rapport. That requires more than just a 15-minute appointment. I will say you have to like look at a human for who they are and listen to their story to be able to like pick out the parts that could potentially help them. Right. And the one thing I cannot bottle, I mean, I'd be a billionaire if I could, is like time. You can't accelerate the process, because our bodies, though they want to heal, it can take time to heal. And when a patient is sitting in front of me for the first time, I'm like, well, did it take you 20 years to get here? 30, 40? Like what are we working with here? And I think we've gotten better at articulating over the years, like giving people a timetable is super helpful, so that they kind of know like, okay, this is going to take you X amount of months or X amount of years, depending on like what are we digging out and like what layers that we're addressing. And everybody's going to be just so unique. But the part that is not unique is the working for it.
Right. And that's it. In the workout world, they say like Amazon, we're not Amazon Prime. It doesn't take 2 days to deliver a perfect body. And in the healing world, that's very much the same thing too. It's like it's not going to take a blink of an eyeball for you to find the root cause, build immunities, get yourself the right supplements, make your body move and kind of express healing any faster than if you were to just start. And
I will say, one of the hardest things for me to actually tell a mom to do is to be like, hey, you might want to, take a few months and work on these few things before getting pregnant again. And the only reason I can even muster up those words and actually say them, because I know like, man, if a woman is in my office wanting to get pregnant, she wants that badly. Like that is something she wants realized. And it's already been delayed. If she's sitting in my office, it's already been delayed. And the only way I can actually like say those words sometimes and be like, hey, you may want to consider waiting, while still respecting their decision and going, if you don't want to wait, that's okay too, is knowing on the flip side of like birth, pregnancy, birth, postpartum, that baby, like the ripple effect that can happen if some of those things aren't aren't healed.
Right.
It can just create like it's a snowball effect. It's like adding gasoline to the fire.
Right.
And so we'll like, I'll obviously like bring it up and say, hey, this, you might want to consider it. But at the same time, like I have families who all the time don't.
Yeah.
And then I have to still like respect their humanness, and that's their decision and that's their autonomy, and still be willing to still like help them and be alongside of them, even if they bring me the double time, like 2 times the mess.
Right.
You know, and so like, because we're humans and like it's complicated.
It's complicated.
So-
why do you think there is this shift for more patients into the integrative care?
I think, I don't know. I do think internet and social media plays a role, you know, of things that are like, were talked about only behind closed doors and then with friends, you know, like that small, like murmuring of like, my doctor said this. And, you know, or I think it's made a bigger world just so much smaller.
Right.
And so people have had access to like more information than maybe that they had previously.
Yeah. I almost feel like it's a little bit like politicals though, because you hear it, I hear it, you know, in our groups, right? It's getting bigger and it's murmuring, but it also has a level of controversy attached to it, which is so wild to me.
Oh, girl, I
yeah,
know.
I know, right?
I know that.
I mean, people came after your
Personal.
practice.
Yeah.
They came after my license.
Yeah.
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 Crazy.
Yeah.
And was that during COVID?
Yeah. What year was that? See, I've done therapy, and it's already like I'm already zen about it.
And we're like, bring it back up.
No.
Let's go.
It was, yeah. So that pandemic was 2020. Yeah, it was 2018 because I was 6 weeks postpartum with Esme. And that was great. The most fragile time of my life.
Yeah. What was it about?
Good God. I mean, they don't have to tell you. So I know parts of it, but
They don't have to tell you why you're being investigated?
No.
That doesn't seem right.
No.
Jeez Louise.
Yeah. And I had to have like a criminal lawyer. Everybody's going to want to come to my practice now. A criminal lawyer and a medical lawyer. And in the end, they didn't end up taking me to court and absolved me of everything.
That's amazing.
Which is, I did not think it was going to go that way. They wanted me to sign some deal that said I would not practice integrative medicine. And I was like, over my dead body will I sign that piece
Who
of
exactly
paper.
is coming for you?
It was
what
the
department?
state.
Okay.
Yeah, it was the state. And of all the thousands of patients I had at that point, they picked one. And the crazy thing was that patient didn't even complain. Like it was such a witch hunt. The whole thing was. So they've even worked for me. They actually do they currently work for me? I'm trying to think through that. But they love our practice. Their whole family comes. All their kids come.
Right.
And
so they were interviewed, probably had a positive interview, and they still tried to come
I don't
through.
even know that they talked to them.
Wow.
So how does
They
that work?
they just came in and seized files one day.
Oh,
I wasn't
okay.
even there. Darby, my new hire, she was 6 weeks in. She was like, Jamie, there's people here. You should come. And like literally people with suits were there and boxes and were taking everything in front of patients. It was very violating.
Yeah.
And so, 2 years.
Especially as a patient, because you're seeing these
Yeah.
files coming out and you know you're in them.
Yeah.
Right.
You know,
Yeah.
and that's scary.
Yeah.
You know, and then not to not know or to be able to tell them like,
And
this
one
is
of
why
the
I'm being
things was they
investigated.
said I was practicing too much naturopathy, I think is what they termed it, which was crazy because whatever clip they were looking at as far as the law was actually for MDs, not FNPs. It wasn't. They were basically like sourcing. I don't know. They were looking at laws that did not apply to me. But regardless, I was like, what is even naturopathy? All that to say, they said they were going to take me to court for prescribing ginger, turmeric, and like an Inflamex shake from Metagenics.
So something you can literally get at like a Walgreens or anything.
Yep.
Well,
And
because you refuse, not that you refuse, but you very little prescribe traditional medicine.
It was 2 years in and a lot of money in lawyers' fees. I was investigated for two years straight. Yeah, it was super fun. all while building a practice, having babies, wondering, am I doing the right thing here? Like, people are really angry at me. And I found out that when they seized the files, they did not get the medication administration record. And they so they basically were like, she's just doing ginger and turmeric and never using medication.
LOL.
Yeah. And so once they got, and I'm like, don't you guys have like drug dealers to go look into?
Yeah, for
like,
real.
I like over here miss like,
Don't you have a laptop to not talk about?
yeah, like it is
You know,
crazy.
I will tell you, outside of medicine, the last couple of years, man, the amount of mishandling that the government does, that does not surprise me, that a government agency would come after you for your practice to make sure that you're doing everything on the up and up, and miss the files that they would be coming after you for. And instead of saying, hey, here's a medication list of every patient, they said, that bitch is only prescribing turmeric, and that is a problem for us because what?
Yeah, right.
Correct.
I mean, holy crap.
So once we submitted that medication administration record, it all went away.
Yeah, they were
went
hoping
away.
they were hoping you didn't figure that out.
Yeah.
I guarantee it. I guarantee they intentionally missed that so that that is wild. But it's not the first time I've heard this. I mean, when we started this podcast, I laugh all the time because, you know, in my own on my own Instagram, I'll post, I don't know, a picture of Riv or like me at the beach or, you know, a family photo, and it's like 45,000, 60,000 likes. Like, I get, you know, great deals with like, you know, partners and stuff. And then the second I post something about here, when we start, and we've only been talking about breastfeeding and circumcision.
Yeah, circumcision did horribly.
Horribly. No,
Horribly.
It gets smothered so crazy. And so in the same way, I see, like, you know, because you had mentioned it even on your own social media, but the fact that a government agency would come in here and they would just smother your practice.
Yep.
That is wild.
Oh,
But it's
sure
not
tried.
surprising. It's not
They sure
surprising
tried.
that they do not want, right? And so the argument is, wow, it's open. It's, you know, there's a lot more information on the internet, TikTok, Instagram, what have you. There's a lot more information out there that would bring people more into this integrative care, yet it's still being super suppressed.
Yeah. Yeah. And I actually did a therapy session recently. I think that people might think it's weird. A healthcare professional goes
No,
and
I
gets
think you
therapy.
should.
I'm like, every medical professional
Needs it.
Yeah.
and police officer probably should be doing
Oh,
therapy.
those are the two people that I think all of the time, because you guys are dealing with every single personality that could possibly walk through your door.
Yep.
With every single ailment
Yep.
and or things.
And HIPAA.
probably
so
shouldn't
we're
say-
not telling our besties about our day. Like, I'm not even telling my husband about my day. So like,
Oh, yeah, 'cause you can't. You
Because I can't. So
Yeah, you're like a priest.
I am a priest. Yeah. Like, I'm not saying anything,
Right.
you know, about anybody.
And
To
you're
anyone.
So you're holding in every
To
energy.
anyone, yeah. So I am for sure seeing a therapist.
Yeah.
And we do great work. I see Dr. Paul Hodgins. He does NET. So shout out to him because he's like holding this whole brain together. But all that to say is I had to work out recently in therapy the fact that they could come for me again. There is like no immunity. And so like either, you know, and that was even the part of like me even starting my Instagram page. Part of it was the pandemic, and I love teaching. And so I used to do in-house workshops and seminars. And I had this whole awesome calendar for 2020, and it just like blew up. And I was like, no one's coming to these. Okay, cancel, because no one was coming to any in-person anything. And then I was being investigated and feeling really down. And I was like, I'm either going to get really mousy and really quiet, or I'm going to walk in the authority I know God gave me and be like, what?
Yeah.
You know, like,
Yeah.
And so it was really like a really conscious choice to try to find another platform that I could educate on. And I'm really, you know, I know people have a love-hate relationship with social media, but for my purposes and what Hopewell has needed and Nashville has needed and even the U.S. has needed, I've been very thankful for it because it has done that. It has provided that.
So even with the controversies that you get, like PancakeGate, you think it's still beneficial?
Do you know? Okay, so I have never taken the Enneagram officially, but you know, and I know you're not supposed to tell
Probably-
someone
you're
who they
probably-
are.
yeah.
But
Yeah, I was
everybody
just saying
says I'm an
eight. You're an
8, and I'm
eight.
like, is it because I'm a
You're an
bitch?
8.
You know, and they're like, no, it's because you're a fighter.
Yeah.
And you fight everything.
But then there's that sensitive side to you as
I'm
well.
very
There's like a 2.
sensitive.
There's an 8
Yeah.
too.
I am really
Yeah.
sensitive too. So yeah, I it doesn't bother me. That does not bother me.
that.
Anybody can say anything.
Well, because you're so convicted in what you're. I mean, you know you're doing the right thing. You know you
Yeah.
do your research. There's not
Yeah.
really much. What could they possibly say?
Does it fire you up more?
It makes me laugh. My husband's like, "What is so funny?" I'm like, "This person who thinks they've bothered me. This
Wait.
is what's so funny."
Like, what's her name? Lead Safe Mama.
oh,
Okay, wait, that's a whole.
bless her.
That's a whole other.
Bless her.
controversy.
No, I only have one thing to
No,
say
yeah.
about her is honestly, I feel like somebody has hurt her, and I have all the love for her.
Yeah.
I really do. I was just like, oh, you're not okay.
Well, okay, so that's
Back up,
okay. So
yeah.
that's where I want to go into with the other. There's in your care, you're a medical professional, but there are other bloggers, mommy bloggers, what have you. I would even put Food Babe in there, right?
Yeah, sure.
There are groups of people that are coming out, albeit with the best of intentions, I believe, to better educate, mamas and people parenting alike on better options for your kid health wise. However, there is a little bit of fear mongering in there.
Yeah.
And I think that's when we pass the exit. And so that I was kind of glad to see that interaction happen because, there are people that I follow that on a scale, they are on such a pedestal of who they are that people follow them blindly. And there's nothing wrong with what they're saying or what they're doing. But you do, people so badly, I believe, want to belong to, and that's why cults were formed, right? People so badly want to feel like they belong and or they are in the know of something that people like Lead Safe Mama. Sometimes I don't think they realize the impact and the power that they have. And so when you tell somebody, your shit's poisoning you, and I'm sorry you think that's the good stuff, but it needs to go. It's like Oprah. You now are going to destroy an entire industry. These people are going to go basically bankrupt because they're going to go buy another salt, right? It was because the whole thing was over the salt and the lead.
Yeah.
And there have been times where I would even post it and I would feel so hopeless because I'm like, where do I start? Do I throw out all my freaking pans? Do I move out of my house?
Yeah.
Do I stop letting my kid play with Love Every? I'm like, where does it end with the lead? I don't know. And then there's a bajillion other chemicals out there. But in her case, I do believe that like, you're right. Something has also scared her because once you get so obsessed with it, it's hard to get yourself out.
Yeah.
I think that's what makes me weird or a unicorn in that I just love to learn. So that if you actually do teach me something that I didn't know, I'm probably not going to be like, well, how dare you teach me something?
Right.
I'm never going to be to a place where like I know everything. That would be impossible.
Right.
And so like, as long as I think in the medical world, you can get like a little bit of a godlike complex. And that's where like humility comes in and remembering like you are finite and you are a human and you can learn shit. Like you and so even in that interaction, I tried to learn. It wasn't really an interaction.
Okay, so what happened originally?
What do you mean?
Like, how did the interaction come about?
Did
someone tag you?
Yeah, I think people tagged me
about Redmond salt.
but it was
right?
a seaweed. It was a seaweed.
Oh, dang, those seaweeds.
It
Yeah.
was seaweed. Those awful, evil seaweeds, man.
And your kids had been
Get
eating
you.
like a crazy amount.
Oh yeah. So they had that a month, eaten probably 100 packages of gimme seaweeds, and I was like, hold up, my kids eat those. Why are they not like barfing and passing out? And like if it has everything in it, like the arsenic and the lead and the cadmium and everything, mercury, I was like, why are they okay? Because this was not meant to be an experiment. They just happened to have eaten like a crap ton of them that
Divine
month.
timing.
Yeah. And so I was like, okay, I'm going to test some of these things. So like we took a family road trip to the clinic and I just started testing them for lead and capillary draws and venous draws and all sorts of things. Cause I'm curious. and was willing to also be proven wrong. And when that's the thing about like anything is like when there is a truth and a truth, but they don't match, what's the truth between the lines? And that's what I was hoping to have found out with her.
Right.
And then I really realized really quickly that conversation couldn't happen.
Yeah. That was the only thing I can describe to it. And I'm sure I'm going to get some shit. Was I was a super vegan for about 5 years in Miami, and I started to incorporate meat because I truly believe in like in your case, I'm almost incapable of being radicalized, right? Like in my mind, I'm like, okay, if I'm wrong, then I'm gonna move on, right? And there was a part where my iron stores were getting really low, and I never had issues with iron stores. I don't have issues ever in your office with my iron stores, and it came down to I was not getting enough protein, right? And so I was okay with going back because, you know, it wasn't an animal thing for me to be vegan. It was more of a health thing. And when it was no longer a health benefit, I was okay with moving forward. But in that community, absolutely not.
Right.
Preposterous, you know, and I got a lot of backlash because I was even featured in like vegan magazines at some point. And so that's the only thing I can describe it as is like you get into these huge, I'm going to say mama communities because I think mostly mothers are following this because you want a very healthy baby. You don't want your baby to get sick. And I think when you follow these accounts, your intention is to make sure that you're doing the best for your baby. But if you get so obsessed with it, you're going to live in a box and that box isn't going to feel very fun. And then it gets scary, right? It's no different than if you watch the news every day and then you think murder happens in your backyard in every 20 seconds, right? You can't walk through this. Yes, and to your point, what I loved where you went with this about the salt and the seaweed was, okay, so these things may have and incorporate this, but you don't throw it all out. You're not going to throw the baby out with the bathwater here. Let's talk about what it does mean, how we can support our bodies through it, and is it really that unhealthy, right? Are these levels, if you know, I'm seeing something different than you are, where's the conversation? And then you have these like torchbearers that just get so crazy. I mean,
They're one-track minds.
And it's down back to cognitive dissonance. People do not like being told this is not exactly the way you say it is.
Well, I think
and let's
like,
talk about it.
I think after COVID too, like I hate to make everything about COVID, but it really rocked. It rocked our worlds.
Yeah.
And I have found people's nervous systems are not the same afterwards, you know, and when it comes to moms and their babes, I mean, like those nervous systems are basically like one heartbeat, you know? And so I really feel for mamas because in a society that is kind of a little bit fear driven in a lot of ways, I mean, like we wouldn't have lawyers if we weren't a fear-driven society.
Yeah. Super happy.
That it really impacts our children as well. And so I do feel like a big part of my job at the clinic every day is just to diffuse bombs, like diffuse bombs one at a time, and help moms breathe again and not feel so guilty and think through it logically. But like when it's your own flesh and blood, like it your ability to kind of think logically goes out the window because you're a little bit of you can get to flight or fight kind of quickly. And so you see this thing on the internet is like, this is bad for your kid, it's gonna kill your kid. Yeah, you're gonna have like a reaction to that. So that's why I kind of wanted to engage in it, because I am for families, and it wasn't met with the
Neither was PancakeGate.
Yeah, that one made me laugh so hard.
Okay,
though.
so what can you explain? Because that resulted in a book.
Yeah, well, kind of a book. It's a e-guide. It's 40 pages. But yeah, that one, I love talking about fact finding on your own body. And so there's like just a few ways I encourage my patients to try it and like figure out you, because like I have one set of labs and maybe some other fancy tests that we do, but like you paying attention to you and then like bringing back those facts helps us figure you out in like rapid pace. So like if we do want to accelerate your care, like fact finding is really cool. Your own biometrics, right?
Right.
And so like, I wear a Whoop. This thing is so old. It's like so dinged up and banged up and dented. This one tells you like about your heart rate and oxygen and temperature and your sleep and your recovery and your strain and all of that. But I was pushing people to maybe consider wearing glucometers.
I wore one.
Yeah.
Yeah.
And was it fun?
It was fun. It was fun to look at and to see what I ate and like what would happen afterwards.
Yeah.
But I also noticed like I think there was everyone's so different because
Yeah.
I think another person that went to my gym was also wearing one.
Yeah.
And like we were just comparing notes and it's just like everyone is so different. It's so important to know what your body reacts to.
Well,
Right.
people were like really kind of upset that I was recommending
Yes.
glucose monitors for people who do not have diabetes. And I'm like, well, one, you know, like oxygen is a molecule, you breathe it in, everybody knows it will affect every cell in your body. If you don't have it, you'll die. Glucose is another molecule, very important. It will impact every cell in your body, whether you want it to or not. So if it's like going up and down and all over the place and spiking and crashing and it's never consistent, it's kind of akin to like being in a car and the gas is like going and stopping, and you know, it's not effective. It's not that car is not an efficient machine at that point.
What is glucose responsible for in the body?
Literally everything. It fuels every cell in your body. So, you know, I'm very aware of like snake oil, and you're like, take this one thing, it'll make your life better. But glucose very much is one of those things. It's impacted by a lot. So like glucose can be impacted by obviously what you eat, what you don't eat, your sleep, magnesium levels, your stress levels, if it's hot or cold outside. So it's very temperamental, right? But it also impacts every cell in your body. And so like if you are not getting over sickness easily, like it's like, okay, well, what's fueling your immune system? If that sore on your arm is not healing, it's like, okay, well, what's helping your skin heal? If you're not sleeping well at night and having insomnia, it's like, okay, well, what's fueling your nervous system? You know, like we could literally go through every single system of the body and find a glucose connection. So it's a big guy. It's like, if you want to impact a patient, glucose is something that you should definitely bring up. And most, you know, doctors are only going to bring it up once you become classically diabetic or you are.
But that's almost too late.
Yeah.
Right.
But
So
when they can write a script,
Right.
essentially, like here's some metformin, here's some insulin, you know, that's when they care. But yes, it's way too late. So it's a very, very short range of glucose, like the normative values. So 4.9 to like 5.2 would be considered normal. Pre-diabetes is like 5.7 to like 5.9. So like that's a very tiny range. And then diabetics are like 6.5. So it's very, very, very tiny range. And so 0.1 to move that down, 0.1, working hard and knowing how your glucose is doing, it can take months to even just move the needle a little bit. So like people coming in and they're like, get me off my insulin. I'm like, this is going to take years.
Wow.
You know, like, you know, or, hey, doctor said I needed metformin. Okay. We have got a lot of work to do. We have to fix your sleep, your nervous system, your fuel, your muscles. Like, you know, it's a overhaul and they didn't get there overnight. So I'm suggesting patients like check in on their glucose before it gets there. And people are like, whoa, what are you doing? What are you doing, Susan?
Why is that so controversial? Because it's just kind of like a slap in the face to diabetics. Like why?
You know, I actually asked that because again, I'm open-minded. I polled all the diabetics following me. I'm like, is this insulting? You know, and they're like, it's only insulting when people come to the pool and they're like, oh, you're wearing a glucose monitor too? Cool. And they're like, yeah, I have to live, you know, not cool. So I've even told patients like, please don't just like go up to another person who's wearing a glucometer. They might actually be type 1 or type 2 and absolutely have to. So it's not like, hey, we're twinsies. We're twinsions, you know, like please don't do that.
Yeah, we're all wearing Oura rings and driving Jeeps. So they're giving it all glucose wave.
Right. You know, and then I also asked them like, okay, is it making a shortage for you guys? And they're like, no. And so like I found out it really wasn't the diabetics. Actually, the people who are getting mad at me were dietitians, nurses, doctors. Like, how dare you do this? You know,
because I think it goes again to like this preventative medicine.
So people really lost their minds because obviously we're in the South. when I posted my Pancake blood sugar scores, because I was like donating my body to science.
Yeah.
And going, this is what happens when we eat this. This is what happens. And you should try this too, because it could be different. I think they actually got more mad when I suggested majority of protein shakes.
That was me.
Protein shakes.
I messaged you.
You would increase.
About
Did
protein
you?
shakes.
Did you have
I didn't
protein
have
shakes?
I didn't have a spike when I had the protein shake.
Yeah.
You were like, really?
Yeah. Yeah. I mean,
it's different.
And it can be different.
Yeah.
And most people will be like, could you try this one? And I'm like, but you're not getting it. Well,
Yeah.
how I'm going to react and how you're going to react are going to be two different
Exactly.
things. And so I'm really big into like your own unique biometrics. And people don't like that because
Yeah.
it sets you free. You know, like when you figure out you and you understand how you work and the intricacies of you are no longer chained to a doctor. Like you don't have to go when you figure out you know? So,
But it also, I mean, it bodes this bigger question of, right? It's the trendy ideal of health when you're using things like the Oura Ring or Whoop, or you're
Biohacking.
biohacking, right? People get involved in this stuff without proper understanding and checking in on their bodies. They're just looking for
Quick solutions.
Yeah. Did I lose or gain weight, or do I,
and that's where I kind of feel like I'm the Jiminy Cricket, right? They come in and they show me their levels and their numbers, and I kind of put the pieces together for them and provide them the accountability, because I'm like, okay, in 3 months we'll recheck your A1C and we'll see how you are. I write down all their symptoms too and remind them in 3 months, okay, this is where your symptoms were. Do we improve it at all? Obviously, a number's cool. It's cool if we can move the needle with the number, but like, did you get any obvious benefit from this? And so, I feel like I'm kind of the check-in point. And it's fun. It's fun to help people move the needle when they're motivated to do that. I think biohacking has become its like own thing, and it can become obsessive in its own way. The definition of health is not necessarily like a body without disease, but one where like a person's mind and soul and body are like regulated. And so like, I think always I'd put out that little bit of like, be careful whatever string you start to pull, because it can become this like trajectory you didn't plan on. And I have seen people where like they're really going after their health so hard, but it is actually creating more unhealth in their body.
Yeah.
Because they're like afraid or obsessive or,
I can see that.
yeah.
I think I've gotten there a couple times.
Yeah. It's not hard.
I love data.
It's not hard.
No.
So you do need to be a little careful.
Yeah.
When you talk about individual care or like doing tests on your body, why do you think? Because I know the other thing that you're a big proponent of is genetic testing, right? Of learning who you are as a person, kind of down to your chromosomes here.
Mm-hmm.
Why do you think that is important? If someone's coming into your care, why is blood paneling and kind of genetic testing?
Genetic testing is optional. People can do that. If we start to see like a person, let's just say we're checking somebody's estrogen and it's come back high, and like they've put muscle on their body, they've fueled themselves differently, they've lost weight, they're sweating, they're removing products that contribute to estrogen dominance, but we're seeing like the levels come down, but then they come back up on repeat. In those particular instances, I'm like, you're working really hard. Like you might want to just check to see like, are you genetically predisposed to this? Because then we might need to stay on like a particular vitamin therapy or supplement therapy, and you might need to stay on it because this is like in your blueprint.
Right.
So like, I don't think I'm going to throw it at a person and be like, hi, welcome to Hopewell. Here's your genetic test.
Yeah.
That's not like the first thing we do, but it is something that I recommend. Or, your genetics are your genetics are your genetics. You are born with them. Everybody always asks like, can I go ahead and test my 6-week-old? I'm like, yeah, like that's it. The blueprint's there. So whenever you want to test, you can. I think that comes in with like the jibby jab conversation, that we're seeing some of the demographic do so well, and it's like they didn't flinch, like nothing happened to them, and there's other demographic who's just like, oh my gosh, like definitely injured. What happened? And I can say, having done hundreds of these tests, that you can see on a blueprint before a kid is going to react poorly to this, to a series of 72.
Yeah.
You can literally see it. And one time, I was working with a family whose child was injured and had a whole series of things going on with that kid, doing really well. Like the family had worked really hard and restored a lot of that child's function. And the child wasn't there that day that we were reviewing the Max Gen test with them. And I don't say this super often, but to these parents, I stuck my foot in my mouth and I said, I don't say this frequently, but you would vaccine injure your child if you were to get them any vaccines. And they go, we know. We did. And I was like, oh my God, I totally forgot, because the kid was doing so well at that point. And they hadn't been my patient when they were injured. And so I was like, I am so sorry. I don't think I've ever stuck my foot in my mouth this badly, but it was like the writing was on the wall. It was literally in the blueprint. You could have seen it before.
Do you think modern science is coming around to understanding that as well? Like, do you think,
I think, I think the whole trajectory, unfortunately, is broken. I think the whole thing is broken, and it's really hard to fix something that is that broken. I have hope, but I mean, it is the pharmaceutical companies who fund the medical schools, who then like make the books they read, which then like pay the teachers who teach them. And so it's just like the whole thing is just a parrot, like like, this is the way, this is the way, this is the way. And traditionally or historically, people who have just asked questions, not even said like it should be done away with, nothing, just asked questions, have not been treated well. So it is a very slow movement. And I mean, I even see this like in the mental health field, in that there are the people who made the manual, it's the DMV, the manual that has like, this is schizophrenia, this is bipolar, this is depression, like those labels. They had to make them so that they could fit them, like basically put those symptoms in a box so that way they could treat them with a medicine. And if you look at the medicines and the CEOs of those companies, they are directly relinked back to the people who are on the board who made that manual. And so it's just like you could, it's, I don't care how pure you are and how pure intended you are. If there's like money, that's why I didn't even want, I'm such a purist. I didn't even want supplements in my office in the beginning, because I'm like, anytime there's money, you could change your mind about like what that patient has or what's going on with them just to like generate the funds.
Yeah.
Does that make sense?
Yeah.
And so I'm like, there is no way that the people who made that manual of diagnoses should be shaking hands or be the same people who then get to pocket the money from those drugs. Like it's even in the mold world, a person who checks your house for mold and then the person who remediates your house for mold are not the same person, nor should they shake hands, nor should they refer to each other.
Right. I mean, you see that in government all the time, right? We've seen a lot of like former health officials become part of Pfizer and part of Moderna, right? Or vice versa, right? Because they can't take any funding until one or the other. And so it's a huge conflict of interest. Right. Because you got to wonder, you're like, at what point were you like, I'm going to interview for that job and switch over and go that, right? And so, and what level of power or lobbying is going on that we don't really know about. And look, outside of what is very controversial, which is vaccines and possibly even medications and big pharma. I mean, encourage people to watch things like, oh my gosh, why did that? It just ran out of my brain. Oxycodone. Was oxycodone? The whole oxy scandal.
It's
right?
insane.
When and I mean, it's dope sick. Yeah, and you start to, even if you watch just the Netflix like version of it, you're like, wow, they were, what's your level of pain? I remember even having Riv, right?
Yeah,
I had no pain, and it was very strange that a breastfeeding mom is being offered a narcotic.
I agree. I actually said I don't want it, and they said we're going to give it to you. I was like, don't put it in that bag, and they refused. They were like, we're putting it in the bag. I'm like, I don't need it. I'm refusing it. Right. They would not. They had to write that prescription.
But
for
to
me.
even see like that, that like that little happy face thing was like, what's your level of pain? I'm like, not I'm good, right? Like I'm fine. And that was another kicker. It was like, I know that I don't need the prescription. I may need sleep. I may need a couple extra vitamins. I may need a coffee at the end of the day, but I don't need that. And it was very, because my very next question was, well, if I take this, I'm like, can I breastfeed?
Yeah, right.
And they're like, no, you can't. You gotta wait. I'm like, okay, wait a minute, wait. So the most important thing you're telling me to do is produce milk within the first couple of days for this baby. And then I can't even feed it to that baby because I have a narcotic in my system for pain relief. And that just didn't sit well with me, because I was like, I'm almost scheduled to fail here then, because, and not that, look, if you're in pain and you need it, take whatever, there's no judgment here. But for me, I just didn't understand the immediate need to prescribe something for almost a symptom that didn't exist. And then you watch things like Dope Sick and you're like, oh,
which makes it more interesting
because there's kickbacks and things like that.
Yeah.
Which, you're like, how is that not a conflict of interest to give funding to, practices based on what they're giving their patients? That's insane.
or investigate them for not.
Right.
Right.
That's what I was going to say, is maybe if you prescribe more oxy, they wouldn't have bothered you.
Yeah.
Yeah. And that's one thing they immediately did. I actually saw them doing it, looking me up on CSMD to see how much I had prescribed. And I'm like, you are going to be sorely disappointed. and then I was like, that's it. Right. And I almost kind of wonder sometimes now if it was because my low level of how much I had prescribed. I'm like, is that why they decided to
Yeah,
go
they're like,
after
she's taking it. So where's that book? It's got to be somewhere. It's going to somewhere. Okay, so I know we're going to wrap this up here. What what do you foresee for your practice or for integrative medicine in general? Because I know a lot of people ask us now, even when we just kind of write it here, and I send them to that IFM website because everyone's like, hey, I'm in this town. Where do I find that kind of care? Where do you see functional medicine going and your practice going, in the next 5 to 10 years?
We're gonna hopefully, God willing, continue to grow because people want it, need it. In fact, I have another nurse practitioner who's just completed 200 hours with me, which they have to become a nurse practitioner and then they have to learn how we do things. Yeah. We have, I think, 1,900 people who have already filled out the new patient paperwork. And so I'm already looking for the next one to train.
That's wild.
1,900 people.
Because there's not there. Again, we're in Middle Tennessee and there's maybe 3 practices, and Hopewell always comes up at the top.
Yeah.
I
I think part of it too is we really love people. And I think that comes through.
It does. My husband said that when he first entered your doors, it was a completely different experience. It was his favorite time he's ever gone to the doctor.
Yeah. And I really, I love my employees.
Yeah.
I feel like they're family. We just had one that went to nursing school and I was just like, oh, it rips my heart out every time. But still you're like, fly, birdie, fly. Yeah. We're so proud of you. Benny, everybody loved Benny, and he's in Cali becoming a doctor right now. I really hope he remembers all the things that he saw and experienced on a more human level, So we're growing as fast as is safe. Yeah. I don't want to grow us any faster than we can turn out quality NPs.
I know for us, it's a spa day. Every time we spa day, it's weird to say you go to the doctor for a spa day, but you not just integrate your care, but you have such a great partnership with the other systems in there, Soma, There's the IV Hopewell. So literally we go there and we're like, okay, after this, we're going to go do some halotherapy. And then maybe mom needs an IV. And then, PJ's always about the red light. And I keep asking her, I'm like, ELT, like after this baby pops up, I'm going ELT. But you almost plan your day around wellness. So you go and you get your checkup, and it's not like you leave. It's like, hey, what else can I do to benefit? And then, each stage of life is really there, because the next step, if you're in family care, if you're family planning, there's midwifery that has the same level of care and compassion and approach as you would expect in this care. And to watch both systems work together is really nice, and not something that you often see.
And I think if I were to reflect on my nursing development, I was part of a system where like you ate the new nurse for lunch. Like that's how you broke them in. It was not love. It was not kindness. It was not like, hey, you made a mistake. It's okay. Let's own it.
Yeah.
It wasn't like, I have a problem with you and I'm going to talk to you directly about it and be an adult. It was like, I'm going to talk to her about you. And, it was just like triangulation. It is very hostile, toxic environment. And so we just have a lot of intentionality from even like the development of the employees who are doing that job. It's growing. It's growing as fast as it can grow. I hope it continues to grow.
I'm glad we're on the ride. I'm glad we're in the train ride for it. So appreciate you coming out.
Where can people find you?
Oh, yeah.
Like
on like social media.
Oh,
she's not taking any more patients.
I'm right here. Yes. So Hopewell Family Care. It's a ride. There's lots of drama.
Love it.
My
Instagram, your viral Instagrams are my favorite.
I'm spicy, apparently.
Yeah. I love the spiciness.
And it's a crazy thing. It's like, it's almost like a slot machine. You just don't know. You just pull the lever and you don't know what's going to happen.
Yeah.
It's like a game of chance, and it's kind of fun. You're like, oh, we got upset about pneumonia today. Let's go. let's talk about it. But yeah, Hopeful Family Care. And then, actually, I will say, to enjoy that halotherapy, the salt room or the IVs, the J table or red light or any of that good stuff, you do not have to be a current established patient. Anybody can come enjoy that. And we've tried to do that just because people are waiting patiently to get in, and we're like, we need to make these services available to everybody while they're waiting.
And if you're in Tennessee and you have kiddos, it's one of the only salt cave halotherapy environments that are kid friendly. So what I like about it is, our kids feel like a little bit of sick. We walk right in, and it's extremely well priced for that situation. You bring a couple of your friends, you sit in the salt cave, and you breathe in for a good 30 minutes.
Toys in there.
Yeah. And it's a very calming, it's and that's what I think. River has anxiety about a lot of things in the daycare situations or childcare situations, and it could be the doctor. And the one thing she literally says, "Mommy, I want to go to the doctor today," and that has changed the game for me, because she knows that she's going to get well. She's not going for this checkup that is static, like people care about her, and then she may get to go in the salt cave and play. And so it's really nice to see. Like when people say, like, kids are scared of the dentist, it's very nice to see a child be so forthcoming, because in the case of fear mongering, I want my child to care about their health so much that they are excited to find out more, excited to see their doctors, excited to see the other patients in the room, and know that everybody's kind of on the same page of wanting them well.
Yeah.
So,
well, another thing too is a lot of people have asked me, like, what vitamins you have access to your full script online.
Yeah,
as well,
and
right?
a full script, and they can also just kind of walk in and get any of our curated list.
Yes,
curated list.
I mean, it is a very tightly.
It is very diverse. Yes. I will say, you go all the way from like the essential oils to the metagenics to my favorite is the magnesium. I have not had magnesium at all. We ran out, and so we went and got some from our chiropractor, and it's not fizzy. So it just didn't taste
this is where my 8 comes out again, and like in full force, because we have reps that come in and they're like, why can't you, for the love of God, just carry one brand? Like, they all want the monopoly. And I'm like, and I'll just be like, because your product sucks that does this. And I was like, and I'm like, about people and about the patient.
Yeah.
And I was just like, so I have like 30 different brands.
Which I love that, because that would be my next question. The very last thing I'll leave us with, we'll talk about it probably at a later date, was, with Riv being prescribed antibiotics, I didn't realize that even amoxicillin has red dye number 40 in it. And you're like, holy shit. Okay, so here you're trying to get your kid better, or even with wellness brands or a lot of these meaning well supplements, and they're not created equal. And so it is really hard to find that. And I appreciate you doing the work for the patients and being like, these are the best that I can find that I would give myself and my children.
And towards the end, because so many parents like find themselves in that boat. Like, I just gave my kid an antibiotic. What the hell do I do now? Like, what do I do? And I just felt like the mom in me was like, I want everybody to be able to come to Hopewell, but it's just not the reality quite yet, even ones that are out of state. So I did actually write a 7-course gut program to like how to heal your kid's gut, and it is nuanced for kids. Yes, adults can use it, but like I used vernacular for parents to empower them for their kids, and it's like walking you through like 7 visits of like gut health. So anyway, and it gives you the dot to dot to figure it out yourself, and I love it so much. And it was like my mama heart, because I was like, I have to do something. So it took me a year to write it, but I did.
I love that.
I had literally just maybe this is TMI or very heavy for the ending of a podcast, that I had just lost a 20-week pregnancy, and I filmed it literally 2 weeks later, and I was like, this is still going. We are still doing this. This is like, moms have to have this. And so it was kind of like the happiest part of that season for me. So if anybody needs a gut health program for kids, it's there.
We're on the train right now. We can't take enough probio meds right at this point to get the good stuff back in. Yeah. Jamie, thank you so much for coming in.
Thank you so much.
Appreciate you.
Yeah, absolutely.
And I hope you guys tune in next week for, I don't even know what's going on. Every other day is something different. It's that time of year where Courtney, thankfully, is the most organized human being. But we'll let you know on Instagram. Check out Truth Mom Pods. Truth Mom Pods.
Daka.
See you guys.